everyone, Assalamu alaikum. In this video, we are going to discuss the mandible or the lower jaw. So mandible is the largest and the strongest bone of the face. It's horseshoe shaped and it develops from the first pharyngeal arch. The mandible has a body and two rami. Let's talk about the body of the mandible, in which we have the outer and inner surface. So the outer surface presents the following features that are the symphysis menti. There is a line at which the right and the left halves of the bone meet each other. Mental protuberance, which is a triangular projecting area in the lower part of the midline. Mental foramen, which is located between the lower premolars. Oblique line, which is a continuation of the anterior border of the ramus of mandible. And lastly, we have the incisive fossa, which is a depression that lies just below the incisor teeth. Moving to the inner surface, we have mylohyoid line that runs downward and forwards from below the third molar tooth to the median area below the genial tubercles. Just below the mylohyoid line, we can see this concavity. This is the submandibular fossa, and above the mylohyoid line, we can spot this smooth triangular area, which is sublingual fossa. Now, in the posterior surface of the symphysis menti, we can see these four small elevations. The upper two is the superior genial tubercle, and lower two are the inferior genial tubercles. And last is the mylohyoid groove, which is present on the ramus. Now, let's talk about the ramus. It is quadrilateral in shape and has two surfaces, which are lateral and medial. There are four borders, which are upper, lower, anterior, and posterior, and two processes, coronoid and condylar. The lateral surface of the ramus is flat and bears a number of oblique ridges. Medial surface of the ramus has mandibular foramen, a sharp tongue-shaped projection lingula, and mylohyoid groove. If we draw a line at the center of the ramus, at the level of the occlusal surfaces of the teeth, we will see that the mandibular foramen lies a little above this line. The mandibular foramen leads into the mandibular canal, goes through the body of the mandible, and opens at the mental foramen. The upper border of the ramus is thin and is curved downwards, forming the mandibular notch. The lower border is the backward continuation of the base of the mandible. Its anterior border is thin, while the posterior border is thick. This is the antero-superior part of the ramus, and this is the posterior-superior part of the ramus. Note that the coronoid process is a flattened triangular upward projection from the antero-superior part of the ramus, and the condylar process is an upward projection from the posterior-superior part of the ramus. Talking about the muscles connected on the body of the mandible, we have the buccinator muscle, which arises from oblique line below the first molar teeth. In front of the oblique line, the depressor labia inferioris and depressor anguli oris arise. Notice that the mental foramen is above it. Here we have the incisive fossa. This fossa gives origin to the mentalis muscle. We have the mylohyoid muscle, which arises from the mylohyoid line. We have genoglossus muscle, which originates from the superior genial tubercle. Notice genoglossus is made up of two words, genio plus glossus. Now genio tells us its origin, which is superior genial tubercle, and glossus tells us about its insertion. So glossus means tongue, so this muscle inserts onto the tongue. The other muscle is geniohyoid, which originates from the inferior genial tubercle, and here the second word is hyoid. It means that this muscle will insert onto the hyoid bone. Then we have anterior belly of digastric. It emerges from the digastric fossa at the bottom of the jawbone near the mental symphysis. We have the platysma muscle, which is attached to the lower border of the mandible. Let's focus on the lateral surface of ramus. The lateral surface, except the posterior-superior part, provides insertion to the masseter muscle. This posterior-superior part is covered by the parotid gland. The lingula gives attachment to the sphenomandibular ligament. Let's have a look at the internal view of the mandible. Here we have the mylohyoid groove at the internal surface of mandible. The medial pterygoid muscle is inserted below and behind this mylohyoid groove. Now focus on the coronoid process here. The apex and medial surface is the insertion of the temporalis muscle and extends downward onto the anterior border of the ramus. Now focus on the pterygoid fovea here. The lateral pterygoid muscle is inserted onto the pterygoid fovea. Here we have the superior constrictor muscle which originates from the area above the posterior end of the mylohyoid line. Pterygomandibular raphe is attached immediately behind the third molar tooth in continuation with the origin of the superior constrictor muscle. Let's talk about the foramina and relations to the nerve and vessels. Mental nerves and vessels transmits from the mental foramen. The inferior alveolar nerves and vessels enter the mandibular foramen into the mandibular canal. Now, foramens are an entry hole just in case you don't know. Mylohyoid nerve and vessels lie in the mylohyoid groove. In front of the mylohyoid groove, we find the lingual nerve. The inferior alveolar nerve and vessels and the maxillary artery is related to the area above and behind the mandibular foramen. Mesenteric nerves and vessels pass through the mandibular notch. The auriculotemporal nerve and superficial temporal artery can be found very near the medial side of the mandibular neck. The facial artery can be palpated in front of the antero-inferior angle of masseter. Let's talk about ossification. Mandible is the second bone to ossify after clavicle. But does it ossify in membrane or cartilage? Most of its part ossifies in membrane. The part that ossify in cartilage are incisive part, coronoid and condylar process, and the upper half of the ramus, which is above the level of the mandibular foramen. Here is a picture of Meckel's cartilage. Each half of the mandible ossifies from only one center at the 6th week of intrauterine life in the mesenchymal sheath of the Meckel's cartilage near the future mental foramen. These two halves eventually fuse via fibrocartilage at the mandibular symphysis. Thus, at birth, the mandible is still composed of two separate bones. Ossification and fusion of the mandibular symphysis occurs during the first year of life, resulting in a single bone. Let's talk about 8 changes in the mandible. The mandible changes throughout the life. In infant and children, the angle of mandible is obtuse with 140 degrees or more, making the head in line with the body of the mandible. Whereas in adult, the angle decreases to about 110 to 120 degrees, making the ramus almost vertical, and in old age, the angle again becomes obtuse about 140 degrees. In newborns, mental foramen is close to the base due to the presence of teeth within the body of the mandible. In adult, the mental foramen opens midway between the upper and lower borders due to the deposition of bone. And in old age, mental foramen is close to upper border due to resorption of bone and loss of teeth. In clinical anatomy, remember that the mandible is commonly fractured at the canine socket. The next common fracture of the mandible occurs at the angle and neck of the mandible. Now let's summarize. Mandible is the largest and the strongest bone of the face and has U shape. It has 2 surfaces and 2 borders. The outer surface of mandible includes mental protuberance, mental tubercle, oblique line, and mental foramen. The inner surface includes mylohyoid line and grooves, sublingual and submandibular fossa, and genial tubercles. The ramus of mandible has 2 surfaces, 4 borders, and 2 processes. The nerves related to the mandible are mylohyoid, lingual, mental, mesenteric, inferior alveolar, and auriculotemporal nerve. The arteries close to the mandible are mental, facial, mylohyoid, inferior alveolar, maxillary, and mesenteric arteries. The muscles attached to the body of the mandible are the buccinator muscle, masseter muscle, temporalis, depressor labii inferioris, mentalis, orbicularis, and depressor anguli oris. The most common site of fracture in the mandible is the canine socket, and second common is the angle and neck of the mandible. Now, some important questions from this topic include: name the nerves which are closely related to the mandible. Describe the general features of the ramus of mandible. Name the muscles attached to the body of mandible. Thanks for watching this dental video. If you are interested in watching more videos like this, you can download our app and sign up for Dr. Teeth Prime. With Dr. Teeth, you can avail high-quality education without feeling the burden on your wallet. Our courses cater to the difficulties experienced by the students and come with engaging animated videos, helpful illustrated notes, and multiple choice questions. So see you soon. Take care. Allah Hafiz.